है ना? So basically when we say general practice, it is family medicine is something which is evolution of that historical tradition of general practice. Understood? So it is evolution of historical tradition of general practice. That you keep in mind. Basically, it is general practice, but in very evolved form. So family medicine is a clinical medical specialty. Okay, it is a clinical medical specialty which has been even recognized by DNB board. You must be knowing diplomat in national board. That means we have DNB in family medicine. That is equivalent to MD in family medicine. That is the course which is available for specialty. So it is a specialty, and we have DNB in family medicine. That you keep in mind. Okay. So this is one of the field, but it is a very important specialty as far as community is concerned. Because here what we consider is doctor in the community. Okay. So usually when we say family medicine is basically devoted to continuous and comprehensive medical care. Continuous and comprehensive medical care. And comprehensive medical care means medical care or health care. Usually it is like primary health care, where we provide promotive, preventive, curative and rehabilitative services in one package. Understood? Promotive means health promotion by health education. Curative is your clinical medicine, whatever is there curing the disease. Curative and preventive is prevention by immunization. And rehabilitation, you know, when the person has suffered from some irreversible damage because of the disease. Like he has turned persons with disability, they need rehabilitation. Understood? So this is providing comprehensive healthcare package that you keep in mind. And that comprehensive healthcare package is usually delivered in continuous. Continuous means not only the patient is committed to the physician, family physician, but even the doctor or the family doctor is committed to the patient. Okay, so he provides continuity of care. आजकल के जैसा नहीं है, आज इस डॉक्टर के पास गए, कल उस डॉक्टर के पास गए, ऐसा नहीं है. Family medicine means continuity of care. You stick to one general practitioner who knows everything about you in the context of the environment. Means he knows you in which environment you are there and what are the disease you are prone to or you are suspect. Okay, understood the basic concept. And problem is the family physician deals with both the sick and healthy. खाली उसमें sick नहीं है. Healthy means for prevention. Sick is for the curative care. Okay. So it is the first level of contact between the patients. Usually the family physician provides the first level of contact between the patients and the healthcare system. It is first level of contact like primary healthcare. Understood? And basically we are following the concept of man in his environment. What are the environmental factors which are affecting, which are causing disease in that particular individual? Understood? This is the basic concept of family medicine. So a specific learning objective of today, as you can see, explain the philosophical foundation of family medicine, understand the principles of family medicine, describe the characteristics and function of family physician, and describe the elements of family medicine practice and their interrelationship. We will study this subject under or this topic under these subheadings. Understood? Okay. Now you can see these are all the which we will repeat again and again. So these are all you can see are the these are all the philosophical foundation of family medicine as you can see. Okay, उसमें सबसे ऊपर देखो patient care है. हाँ, सबसे ऊपर caring means patient care. The family physician should be clinically competent. The services should be cost effective. Okay, because we are always short of resources, we want services should be cost effective. Okay, properly means at low cost. Then, as I have told you about the continuity of care, through the entire life cycle of the individual, the family physician provides the comprehensive health care. That is continuity of the care. Then I have told you about the comprehensive health care, preventive, promotive, curative and rehabilitative. Then common problem. That means what happens, the family physician is usually tackles all the problems of that particular patient, irrespective of the age, gender, disease or body part. Okay, he is capable of managing everything because it is like general practice. अभी हम लोग और आगे देखेंगे what are the little bit problems here and there, but he is managing everything. That's why it is said common problems management expertise. Understood? Then coordination of care. Coordination of care means he coordinates with the healthcare agencies which are there in the community or the self-help groups or the social groups कि किसको ये patient को कहाँ refer करना है so that he gets the continuity of health care. Okay. Then we have as I community based and care and research means he has to think epidemiologically and act socially. Epidemiologically, you must be knowing epidemiological. What do you understand by epidemiological? Nahin, epidemiology is relationship of disease in relation to time, place, person. Okay? Means determinants of disease, time, place, person. Basically, it is, you can say the etiology part. Epidemiology means little bit near to etiology. But it is hypothesis. We have to prove by different tests. Okay? So, he should act epidemiologically. Means he can conduct research in the community in which he is there. Research can be on just simple observation, or it can be clinical research, educational research, behavioral research, okay, and the social aspect of the community. He can do all the research which is available, okay. So, the research topic can be on which he can work is clinical, epidemiological, behavior and educational research. So that is there. So basically he can do community diagnosis and treatment of community, that means families, okay, that is there. Another thing is, of course, he treats the patient in his environment. That is very important. Another thing is, so next, as we can see, counseling and communication skill. See the foundation, counseling and communication skill. Counseling means since the patient has faith in him, he follows whatever advice the physician gives him. Okay, so to change his lifestyle. You must be knowing most of the non-communicable diseases are because of the unhealthy lifestyle. Unhealthy lifestyle means related to diet and physical activity. Okay? Mostly the diet में problem है, या physical activity नहीं है, या बहुत stress है, या whatever. So these are the lifestyle related diseases which are very common nowadays in India apart from the communicable diseases. Okay? Then continuing medical education, चाहे वो स्पेशलिस्ट हो या ये फैमिली डॉक्टर हो, सबको वेल इन्फॉर्म्ड रहना है. That is continuing medical education. Whatever we are interacting, it is continuing medical education. Understood? Then, of course, the first element, caring, as I have told you. Now, same thing here also repeated in point form. Just read once. If anything you have not understood, you can tell. Whatever I have told you till just now. Okay? Next slide. See, these are you can see all the principles on which family medicine is based. These are the principles. Okay? So principles, first is, he is dedicated. See, there are 9 principles as you can see. सबसे नीचे वाला you can see that he is dedicated to the person. Okay, dedicated means that guarantees continuity of care. Understood? Dedicated to the person means patient भी committed है, family doctor भी committed है to the patient. Okay, so dedicated. Then understand the context of illness. Okay, एक illness का हॉस्पिटल में पिक्चर अलग रहता है और दूसरा पिक्चर रहता है इन द कम्युनिटी. ओके, दैट इज प्री पैथोजेनेसिस फेज एंड पैथोजेनेसिस फेज. व्हाट इज नेचुरल हिस्ट्री ऑफ द डिजीज? Natural history of the disease means how the disease progresses from pre-pathogenesis to pathogenesis state without interruption. तुमने कुछ नहीं किया है, वो प्रोग्रेस कर रही है pre-pathogenesis से pathogenesis phase पे, then it progresses to defect, disability, cured और death. ये सब outcome आएगा, है ना? कोई भी डिजीज को अगर if you are not preventing, not treating in between, then it will go into all this thing. It will turn into a defect, it will turn into a disability or complication, or the disease may be cured. This may happen. Okay? तो लेकिन यहाँ क्या है? The natural history of the disease is best understood by the physician क्योंकि वो patient पहले से उसके clinic में आ रहा था. Then how the patient landed in hospital. So he knows the pre-pathogenesis phase and pathogenesis phase. Okay, that means he was having blood pressure, but he was not getting his blood pressure regularly checked. That's why now he has landed up in stroke. Okay, वहां वो कोई history नहीं देगा hospital में जाके, but the family physician knows that he was following up for BP, blood pressure, but now he has stopped. Now he has landed in hospital. That is understood the natural history of the disease. Then all contacts with patients and you can see it is an opportunity for prevention and health education. Means once you have treated the patient, you have gained confidence of the patient, फिर तुम अपना health education दो उसको, वो तुम्हारा health education अच्छे से accept करेगा. Okay, for the prevention of illness in him as well as his family. Understood? Then he will accept, he will gain confidence in you. So every opportunity of contact with the patient is exploited by giving him by giving health education so that his health is promoted. Understood? अब ऐसा नहीं, we don't want, many doctors don't give health education. Patient बार बार वापस आना चाहिए उनके पास, हाँ, ऐसा नहीं होना चाहिए. But family physician thinks about health promotion. Okay, and that too not only individual but family also. Okay. Now next will be all contacts with patients. All contacts with patient and opportunity for prevention and health education that I told you. Now he is also population at risk. Population at risk means he is staying in the community, same community, same problem faced by the community and him. Okay, so he will represent that community in presenting that problem. Okay, अभी कुछ potholes का problem है, there is mosquito breeding. For the sake of community prevention of malaria, he will complain to the health authorities or whatever pesticide control department who will come and do the filling, drainage, all that part. Okay, so that pothole filled with water, which is excellent breeding place for mosquitoes, is avoided. Understood? So he is himself part of population at risk because he is practicing in the same community. Okay. Now next is data. He is capable of doing community networking. Networking, as I have told you, he is very much aware of health agencies, NGOs, self-help groups, social workers, where he can send the patient. Political organization जो help करेंगे patient को. This is the main, see, up to when we are primary care physician, this is a type of primary care physician, we guide the patient where he has to go. Main है patient को मालूम नहीं है किधर जाने का है. You have to guide the patient, means if he has financial problem, then he has other social problems, then any familial problems, he should be properly guided. So ऐसा network है community में where he can be counseled and health care can be availed. Okay? Then, as you can see, he is in line or a part of, you can say, complex of community. You in community, a part of complex of family relationship, as I have told you, is from the same community. He visits patient, home visit. He examines the patient in his environment. And as you can see, he is involved, you can say, gives importance to the sensitivity aspect of patient. Sensitivity aspect of patient, that we will see some of the slides. As you have seen a movie, Munna by MBBS, where he is very sensitive to the feelings of other. दूसरे के लिए emotional होने के लिए you should have that emotions. Okay? You should have that emotions. You should be ready to develop a relationship. तो ये सब family physician में रहता है. Okay? And then since he is managing a particular clinic or you can say primary health center, he is a manager. And he can manage resources. Resources means money, material, manpower and time. Okay. And so that hospital admission, treatment, investigation, वो बराबर manage करेगा. Okay. And at the same time, he will give whatever training is required for the medical and paramedical staff. Okay. So he is acting like a manager. See this, same thing again repeated. Committed to the person rather than to a particular body of knowledge, group of disease or special techniques. It is not limited by the type of health problem and has no defined endpoint. Okay. So this we have discussed till now. So he is committed to the person. Seeks to understand the context of illness. Okay. Context means in relation to his environment. क्या प्रॉब्लम है, किधर से प्रॉब्लम है. then every contact with the patient, as I have told you, is an excellent opportunity to give him advice about prevention or health education. Understood? Every contact. नहीं आ रहा है क्या आवाज? Oh, नहीं, it's okay. It's not required. चलेगा. It's okay. So practice as a population at risk. You have seen this in the movie. What are the problems faced by the patient? He is a doctor. He understands कि ये problem patient को हो रहा है, इसलिए he is presenting that problem. Understood? Part of the community means he is whatever work is to be done. Okay? He is interacting with all the agencies in the community. He knows where he can contact and he can help the patient. See, share the same habitat as the patient. Sees patient in their home. You from this you can understand one thing. From this picture, you must be knowing old age people. Old age people, when they come to hospital, they are prone for nosocomial infection. तो उनको खाली फोकट ज्यादा दिन एडमिट रखना, and at the same time, once they are removed from their homely environment, they become more sick. Okay? So it's better if nowadays home-based care is coming into picture. You must be knowing. Even ICU, जो बहुत bed-ridden patient है, उनको भी बोल रहे हैं कि home-based care because of that deadly nosocomial infection. Okay? All that pneumonias which are very common in hospital, which they acquire in hospital. Infections acquired in hospital, that is nosocomial infection. Self-reflective, as I have told you, self-reflective means he gives importance to the sensitivity part. He is very sensitive to the problems of patient. He is emotional and he is in developing a good relationship with patient. अगर ये रहे तो फिर patient और doctor में झगड़ा नहीं होए. Okay? Because when main crucial point is declaring death, okay, to the relatives, so that is the main. तो वो कैसा declare करना है? That's why a senior is involved in declaring death, not the junior, because that sensitivity part, emotion part, and you should be, means something you have to present yourself in such a way that you have also tried, but the patient went. Okay? So that is there. क्योंकि उसको लगना नहीं चाहिए कि डॉक्टर को कोई एम्पैथी नहीं है. Okay? As I have told you, manager of resources, admission or whatever. या किधर किसे क्या अरेंज करना है, manager of resources. See, what are the implications of the principles? We know people before we know what their illness will be. Family medicine may become part of its complex of family relationship, and many of them share with their patients at the same community and habitat. Long-term relationship lead to build up of a particular knowledge about patient. That means what happens? It is not a single time workup. एक बार तुम्हारे क्लिनिक में पेशेंट आया और तुमने वर्कअप करके डायग्नोसिस कर लिया. It may not be correct. The patient is followed properly, continuously watched, then he comes to the clinical diagnosis. कि problem किधर है? That is holistic approach. Okay? Then family medicine cannot divide body and soul as a separate subject. Attention to emotion is the requirement. That I have told you. Emotional aspect. That is very important. See, what is the difference? Most important difference between clinician and the family medicine. You can see. So not normally explore, see, usually the clinician will not normally explore the emotions or that excluded attention to the emotion as an essential feature of diagnosis and management. Attention to the emotions is a requirement, and attention to the socio-economic of the patient is also required. So what then, socio-economic history वो भी important है. तुमने बड़ा बड़ा मेडिसिन लिख दिया, इन्वेस्टिगेशन लिख दिया, not aware about the economic condition of the patient, where he stays, from where he is coming, how he will manage that costly investigation. ये सब देखना है ना. Okay, that is there. So this is the main difference between clinician and family physician. Okay. See, now this is continuity of the care. As I have told you in the beginning only, what is continuity of the care? Continuity of the care involves family physician's ongoing commitment to the patient and his family. That you know, as persons. So it is ongoing commitment. There is hence 5 dimensions of continuity. These 5 dimensions are very important or important element for patient care. See the first dimensions, chronological. Chronological means how the continuity is there. Continuous of the care means the family physician is approachable from home. He's in, you can say, in touch with the patient when he's in hospital, and as well as he's approachable from office also. Okay, he's approachable, and means in spite of the mobility of the patient, the doctor is available. That is chronological. Then interdisciplinary means meeting a variety of needs, means other profession. Other profession means he can suggest physiotherapist, dietitian, whatever is required for complete management of the patient. That is continuity of the care. इंटरपर्सनल रिलेशनशिप की वजह से पेशेंट एक्सेप्ट करता है काउंसलिंग एंड साइकोथेरेपी, विच आई हैव टोल्ड यू. नहीं तो व्हाट ही हैज अ मिसकंसेप्शन, अरे मेरे को साइकेट्रिस्ट के पास भेज रहा है, कुछ तो प्रॉब्लम है. ओके, so he will he has faith in the doctor. He will think that whatever the doctor is doing is in his good faith, and that's why he will accept that psychotherapy and counseling sessions. And geographical means pursued illness in the context of his environment. Pursued illness in the context of his environment. And nowadays, for continuity of care, even if the patient is not coming, we have electronic medical record system. आयुष्मान भारत अभी जो स्कीम है, उसमें पूरा डेटा ऐसा वो लोग सोच रहे हैं कि सब एक पेशेंट के बारे में डेटा एक साथ रहे, so that he has continuous watch on what is happening to that patient. Understood? So this is continuity of care. Now see, cumulative knowledge of the patient. Continuous and comprehensive care allows the family physician to build up piece by piece knowledge about patient and families. Okay? This is known as फैमिली डायग्नोसिस और कम्युनिटी डायग्नोसिस. जब उसको पूरा नॉलेज पीस बाय पीस मिल रहा है, मीन्स आइडियली यू जस्ट रिमेंबर एटलीस्ट 4 times on an average it is seen that at least 4 times the patient visits the doctor in a year on an average. तो वो 4 times में he will try to explore what the problems are there, how it is continuing, what is the problem in his family, in the community. Okay, means that environmental factors. तो उसकी वजह से he will come to the correct diagnosis or the definitive diagnosis. Family, the role of generalist. Family physician by nature and function is a generalist. As I have told you, it is evolved form of general practice. See, these are the misconceptions. कि the generalist has to cover the whole field of medical knowledge. Okay, ये misconception है. And the answer is the generalist knowledge is just as selective as the specialist. I will give you one example. Example is subarachnoid hemorrhage, then you'll understand. Usually in a case of subarachnoid hemorrhage, what is required? What knowledge is required by a family physician? He requires only the presenting complaint. क्या symptoms है उसको मालूम रहना चाहिए. वो symptom के हिसाब से he should do the timely referral. अब specialist का काम क्या है? He should know the subarachnoid hemorrhage का पूरा pathology, how to manage, what surgeries can be done to save the life or the whatever neurological deficit. तो उसके लिए तो the generalist knowledge is just as selective. Means उसको भी selective knowledge है, उसको भी वो चीज के बारे में selective knowledge है. Okay, don't think that he will cover about the thing. There is one dialogue in Munna Bhai, you must have heard that dialogue कि नाक कान गले के डॉक्टर को कुछ नहीं मालूम कि नी जॉइंट में क्या चल रहा है. This happens. This is true also to some extent because अभी कोई ऑर्थोपेडिक सर्जन को बोलेंगे कि ये पेशेंट है मलेरिया, इसको मलेरिया हो गया है, तुरंत कॉल मेडिसिन में भेजेगा. He will not treat that case. वो उसका मतलब वो उसके बारे में बहुत कुछ भूल चुका है. Okay, so it is like that. He is interested in his field and operations. Okay, so this is there. Next misconception, is any given field of medicine the specialist always knows more than the generalist? वो सही है, specialist को मालूम ही है ज्यादा generalist से, लेकिन क्यों? Because we become knowledgeable about the problem we commonly encounter. मतलब क्या कि whatever unusual manifestation है कोई भी disease का unusual manifestation है या disease is rare, we try to refer to specialists because they have learned about that condition in detail. So they are gaining knowledge because of the referral by the generalist. Because it is not that. And of course, after the patient comes, then they also know, this was the case. So specialists are aware about the rare manifestation and the rare disease, and accordingly they treat. For that they are sent by the general practitioner or the general physician or the family physician. Understood? Okay. Then next is by specializing one can eliminate uncertainty. The way to eliminate uncertainty is to reduce the problem to their simplest element and isolate them from their surroundings. Okay? So uncertainty means in the diagnosis and all. So they know how to approach. And it is good, it is diagnosed and treated by the specialist. उसमें कोई problem नहीं है. Only by specializing one can attain depth of knowledge. So, answer is, depth of knowledge depends on the quality of mind, not on its information content. Okay? अभी तुमसे वाइवा में पूछा गया है, whatever useful information is there, that we want. Basic information. You may be informed. Whole textbook you may know. What we have, basic thing we are asking, you are not knowing. Okay. So, it is good to be informed. But, जो अच्छा knowledge है, वो बराबर लेना चाहिए. What we get in lectures and interaction with your teachers. Okay. So, that is there. So, it depends on the quality of mind. Means how you grasp that. It is not, you may be informed, din raat padh ke you may master the book. But what we want the answer. You are not giving in the exam. Okay? So this is the case. As science advances, the load of information increase. Yes, but immature branches of science that have the greatest load of information. Okay, it is not understood. ऐसी भी साइंस जो अंडरस्टूड नहीं रहती है तो उनके बहुत सारे hypotheses, postulates, many things are there. Big books are there because that is not understood properly. Like you can say neurosurgery. Still the brain is not understood properly. Okay? You operate here and there and you develop complication here and there. It is very difficult. So it is such a vast thing and difficult to understand. रोज न्यू रिसर्च आ रहा है तो वो लोग का जो वॉल्यूम ऑफ इंफॉर्मेशन वो बहुत ज्यादा रहता है because it is not understood. Okay? Oh, sorry. Error in medicine is usually caused by lack of information. So you can see it is caused by, answer is, it is caused by carelessness, insensitivity, failure to listen, administrative inefficiency, failure of communication, attitude and skill. Matlab the physician must also know how to see. Physician should be well informed. कोई भी फिजिशियन हो, चाहे जनरल फिजिशियन हो या फैमिली फिजिशियन हो या स्पेशलिस्ट हो, should be well informed. But how to obtain information and how to use it, that is very important. Okay, same thing is here. Why there are errors? Because of lacking information. It is because of all that problem. See, carelessness, insensitivity, यही problem है. Okay. Knowledge and skills required in the practice of family doctor. Basic clinic. See, ये knowledge इतना रहना चाहिए. See, what are this knowledge? Basic clinical knowledge about natural history of the disease, which I have told you. Okay, natural history of the disease means hospital picture and the picture in the general physician clinic. It is different. Pre-pathogenesis phase, pathogenesis phase. Understood? Then human development, normal, abnormal development, you should have knowledge. Then only you can understand abnormal. You should know, you should have basic clinical knowledge about human behavior. How you come to know about human behavior? एक तो you have in your curriculum psychiatry or you have sociology in your curriculum. From this you can understand the basic human behavior, and usually the family physician learns in illness behavior from the patient because of its constant interaction patient से. तो बहुत कुछ तुम अपने practice में learn करते हो. Okay, so behavior of patient during illness, it is learned during your practice. वो खाली curriculum से नहीं आ सकता है. Understood? So that is the knowledge which is required. Then knowledge of patient, community and changing trends. And each community has its cultural, ethnic, demographic, geographic and economic characteristics that may be relevant to practice. That means what happens, ऐसा नहीं है कि सिर्फ old trend, changing trends usually bring about new healthcare issues. Understood? You should know. Like simple virus which causes common cold turn into COVID. तो change हो गया ना trend. तो suddenly you have to have knowledge about changing trend. क्या है अभी? It turned into a very lethal disease. A virus which causes common cold. Coronavirus. Okay? So it turned into a very lethal disease. So you should understand the changing trend as well as you should know about the needs of the patient, and then now the patient is literate. So he wants to participate in the decision making. अभी patient literate है, वो तुम्हारे सब decision को question करेगा. So he wants to participate. So this is the changing trend. So you have to explain him why you acted in such a way which led to the whatever problems, outcome. You have to explain to the patient. अभी ऐसा है. मालूम है ना? Because now the patient is literate, he will go through that Google search and everything, he will be well informed क्या है, क्या इसका complication, वो तुमसे question करेगा. तो the ideas as well as outcome should be properly discussed with the patient. Understood? That is that knowledge. So you should have knowledge about that. Then knowledge of professional community and changing trends, existing and new services. See, existing and new services, complementary and alternate medicine, then herbal medicine, other profession. You should know about, there are services, Ayush services which are available. You must be knowing, वो भी available है in the community में. Then in the community we have new services like hospice, something for the means palliative care. उसके लिए आप patient के लिए कुछ नहीं कर सकते. Now he should go for palliative care. Okay? Palliative care means pain management, symptom management, और कुछ नहीं कर सकते patient का. Like in cases of cancer, where the patient should be admitted. Are there old folk homes in the community where this person can be sent, old age home, where this person can be sent? Or अभी nowadays अभी क्या trend शुरू हुआ है? Day care surgery. You should be aware about that. एक ही दिन में minor procedure is done and the patient is discharged from that. Okay, so that there is no wound infection or other infection because that nosocomial infection. So ये सब you should have knowledge. What new things have come. So these are the knowledge required by the family physician. What new things have come, and this is required for that continuity of care. So other profession means physiotherapy, dietitian, or any other profession which will be in help of holistic management of the patient. Now what are the skills required? Okay. What are the skills required? Now first is general clinical skills. Practical and procedural skills. उसमें पहला history taking. That skill is very important for any physician. History taking. Physical examination. Which simple lab test or skills he can, which he knows, and simple operative skills. Previously, the general, you can say family physician is to do that nail removal operation, CLW suturing, then even in extreme cases, even appendicectomy bhi karte the wo log. Okay, earlobe repair, circumcision operation, ऐसा जो भी है पहला करते थे. तो he should be skilled enough because he is in the community where the referral will be challenging. Because he has to refer to the secondary healthcare and tertiary healthcare, थोड़ा difficult हो सकता है. अगर emergency है तो उसको वो सब skills रहना चाहिए. Okay, why you learn in surgery all these operative skills? अभी तुमको सर्जरी जब सब्जेक्ट आएगा तो you have in viva you are asked कि कैसा एनेस्थेसिया, क्या करना है, ये सब वाइवा में पूछा जाता है. क्यों तुमसे पूछा जाता है? तो MBBS स्टूडेंट कोई भी सर्जन के पास ही जाएगा ना. ओके, लेकिन बेसिक जो है स्किल प्रोवाइड करना, दैट इज वेरी इंपॉर्टेंट एज फार एज कम्युनिटी इज कंसर्न. यू गो टू रूरल एरिया, देन यू विल अंडरस्टैंड. ओके, then special skills like skills of importance to general practice. Doctor patient relationship, this you have heard, ये तो बहुत दिन से चल रहा है. Doctor patient relationship is a vehicle for clinical care. It is a vehicle for clinical care. Okay, then communication skills. This is very important. Communication skills means you should have empathy towards patient. You should communicate as if you are going through same emotions. You have to develop a better relationship with the patient. Okay, and you understand with the sensitivity aspect. You are sensitive to the problems of patient. Okay, to the problems of patient and people around you. See, this happens even, if you are born in a community, it is ek dusre ke kaam aana. So you should be sensitive to the problems of your person who is with you. If you're not sensitive, that means you're not mentally healthy. Okay, that is known as mature, responsible, well-adjusted. That is healthy person. तो maturity मतलब ये है कि you are understanding the problem of सामने वाला है, वो जो भी तुम्हारे साथ है, and you are helping him. Okay, your ego, whatever thing, jealousy should not come in that. Understood? So same thing here also. So communication skill means you're sharing the facts as well as the action taken. तुम बराबर अपने कम्युनिकेशन से पेशेंट और रिलेटिव्स को बताओगे कि क्यों, कहां प्रॉब्लम हुआ और क्यों पेशेंट गया. ओके, दैट इज वेरी इंपॉर्टेंट. Then counseling and health education, as I have told you, counseling and health education is very important for lifestyle modification. अभी बहुत इंपॉर्टेंस है हेल्थ एजुकेशन का, लाइफस्टाइल मॉडिफिकेशन. ओके, you must have seen people dying in gym because they are copying either gym instructor or they are copying their, किसको कॉपी करते हैं, कोई फिल्म स्टार को या किसको भी, आइडियल को कॉपी करते और अपनी कैपेसिटी नहीं देखते. So there should be explained about that कि it is your limit, you should understand. So that is health education. Then skills in managing special groups of patients. I have told you special group of patients, those suffering from chronic diseases, bedridden patient, उनका क्या करना. Okay, so these are there. Chronic diseases patient, bedridden patient, लास्ट में पैलिएटिव केयर चाहिए, किधर कहां भेजना, क्या करना, वो सब उसको आना चाहिए. ओके, देन द सॉल्यूशन ऑफ अनडिफरेंशिएटेड प्रॉब्लम इज थ्रू कंटिन्यूटी ऑफ केयर. दैट आई हैव टोल्ड यू. जो प्रॉब्लम नहीं समझ में आ रहा है, ही विल अंडरस्टैंड बाय कंटिन्यूटी ऑफ केयर. Then identification of risk and early departure from normalcy. Example, he will have a watch. Since he is continuously in contact with the patient, he will have a watch on whether there is loss of weight, unexplained loss of weight, whether he is having pallor, whether he is having, you can say, lack of stamina. All these things he will understand immediately. And he will tell you, do this test. Understood? So this is the skill. Now skills in resource management. As I have told you, he is a manager now. He is managing a dispensary. He is managing a health center. So he should have that skill of कौन से patient को admit करना है, किसको नहीं करना है. That is very important. Okay, किसको admit नहीं करना है. What lab investigations are required. What treatment should be given. Means that is there. And the health staff, whether they are trained from time to time or not under him. Okay, so that is resource management. Always in India we are in shortage of resources, so that is resource management. Okay, and last is practical skills. Means practical, you can say manager. He is same thing, manager. He has to act as a manager. Manager means efficient management of resources. There should be no duplication of services and the services should be cost effective. Understood? Family doctor, family physician. So ideally, you can say in other words, he is an evolved general practitioner. He is primary care physician. Okay. Primary care physician is concerned with the health of the फैमिली एंड कम्युनिटी. फैमिली एक यूनिट है, उसके ऊपर से कम्युनिटी. ओके, एंड ही प्रोवाइड्स कॉम्प्रिहेंसिव हेल्थ केयर एंड कंटिन्यूअस हेल्थ केयर. दैट इज वेरी इंपॉर्टेंट. ओके, नहीं तो तुम सडनली किसी और के डॉक्टर के पास गए, डजंट नो अबाउट योर बैकग्राउंड. सो कंटिन्यूअस हेल्थ केयर दैट इज प्रोवाइडेड. Understood about family physician? So in your reflections, all these things you have to write.